So, good afternoon, and thank you for joining me today. Today, we're going to be looking at our mastering of sleep. And the session should not normally last no longer than 30 minutes as well. So, my name is Paul, and I'm the Training Development Lead here at LifeLink Workwell. So, just to give a little bit of introduction of LifeLink Workwell. So, we are part of LifeLink, a registered charity and a not-for-profit organisation. We've been providing mental health and wellbeing support for just over 30 years now. LifeLink Workwell is a new corporate arm to LifeLink, so we're really focused on supporting that corporate organisations, and we're fully committed to creating workplace equality and supporting staff to be the best that they can be, which you can see there outlined within this slide. Now, at LifeLink Workwell, we have taken the expertise and experience that we've gained over those last 30 years and created a product that will enhance any workplace wellbeing programs. And this includes the offer of counselling services, our wellbeing services, and specialist and consultancy services as well. Employee access to our state-of-the-art mental health and wellbeing app and our online therapy training academy as well. Our corporate organisational healthcare consultancy, mental health consultancy, and our blended healthcare is all included in there as well. Now, I'm sure you can agree from this particular slide as well, there's quite an extensive list. However, it doesn't stop there. LifeLink as a charity is focused on reinvesting any profits into the local community. So therefore, not only adding value to your workplace programmes, but really supporting those local communities alongside this as well. So this session this afternoon, as I said, it's about 30 minutes, a taster session, which provides an overview of topics at a high level. Now, more in-depth sessions are available as part of our service as well. And if you're interested in anything that's discussed today, then again, please do contact us on the email address that you can see on the slide, which is inquirieshub@lifelink.workwell.org.uk. Please don't worry that the web address will also be at the end of the session as well if you haven't captured it at this moment. So the aims of this session today, we are going to be looking at the understanding the science behind sleep. We're going to assess the importance of sleep hygiene. We're also going to look at understanding the impact of poor sleep and the overall health and workplace productivity. And we'll also be able to list practical tips and strategies to improve sleep quality as well. So firstly, we're going to have a look at what actually sleep hygiene is. So this refers to the healthy habits, the environmental factors and behaviours that can be adopted to help you have a good night's sleep. These are also for people who maybe have some sleeping problems, and we'll look at ways of what causes the sort of bad sleeping habits there as well. So some sleeping problems are often caused by bad sleep, those bad sleep habits. And these have been reinforced over years or even decades as well. Now, improved sleep will not happen as soon as changes are made. However, new implemented habits, change of those habits can over time make vast improvements to the actual quality of sleep as well. So firstly, we're going to have a little look behind the science of sleep as well. So there's various stages of sleep that we actually go through, and I'm going to go through these individually. So the first stage that we have is what the class is N1, which you can see there with the yellow colouring. This is the lightest stage of sleep, if you like, and often referred to as the transition phase between wakefulness and sleep, and only lasts for round about 1 to 5 minutes. At this point, you can be easily awakened, and some of us may experience that sensation of falling or leading to a sort of sudden muscle contractions as well. We then have that N2 sleep, which again is, as you can see from the cycle, quite a longer part, which actually lasts for approximately 10 to 25 minutes. And this is becoming the sort of longer subsequent cycle of sleep. Your brainwave activity slows further and you proactively becomes sort of harder to wake at this point. So your heart rate and your body temperature starts to decrease as well, and you'll spend about half your sleep in this particular state. Moving round, you've got what they class as N3 or deep sleep as we probably know it. And this is the deepest sleep stage, and it's crucial for physical recovery and growth, as well as our immune function as well. Waking someone up from this particular stage can be really, really difficult, and they may actually feel quite disorientated for quite a few minutes after awakening at this period as well. You'll typically be in this stage between 20 and 40 minutes in the first half of your night's sleep, and that reduces throughout your sleep period of that particular sleep period. We then have REM sleep or rapid eye movement, is what it stands for, and it typically begins about 90 minutes after falling asleep and makes up about 25% of your actual sleep as well. Now, it's characterized by rapid eye movement, it's increased brain activity, and you have quite vivid dreams at this point as well. And it is thought to support sort of memory consolidation for our REM sleep. It helps with our learning and our emotional processing, all occurs around this REM part of our sleep cycle. So when we think of sleep, that is really, really important, and there is a high importance of sleep. There's more to sleep than just a number of hours that we actually get. Quality is essentially important. Whilst we are sleeping, there are several critical processes going on besides just actually resting as well. Firstly, we've got that memory consolidation. So this is sort of short-term to long-term memory processing and emotions. It is our actual REM, that rapid eye movement part of sleep, that contributes to our memory consolidation. Also, the importance of sleep is those clearance of toxins. This removes the toxins built up during the day, like beta amyloid, which is a protein, where any sort of build-up in that in the brain is actually been directly linked to Alzheimer's disease. Also, the importance of sleep is that brain plasticity. It's how the brain embeds and how you think and act based upon experiences. It then moves us on to the sort of physical repair and growth. The release of the growth hormone during this stage really facilitates that muscle growth, that tissue repair, and that bone building. So, again, equally important when it comes to sleep. And lastly, one of the importance is that energy conservation and restoration as well. This allows the heart rate to lower and the body to recover, ready for that next day that comes along. So, sleep impacts both physical and mental short and long term health. This can affect our mood, our energy, our concentration levels, our relationships, and our ability to stay awake and function during the day. Sleep and health are strongly related, and poor sleep can really increase the risk of having poor health, and poor health can also lead to make it harder to sleep as well. So there is a little statement that's been, or an extract from a book, Why We Sleep, and this is by Matthew Walker, a scientist and professor of neuroscience and psychology. And he states that routinely sleeping less than 6 or 7 hours a night demolishes your immune system, more than doubling your risk of cancer. Insufficient sleep is a key lifestyle factor determining whether you will develop Alzheimer's disease. And in that regard, sleep deprivation is like the smoking of the 21st century. And as I say, that's been put out there by Matthew Walker. So there is an impact then of poor sleep on health and in the workplace productivity. So let's think about the health impacts. So mental health, so increased risk of mood disorders such as depression, anxiety, heightened emotional reactivity, and decreased emotional regulation as well. If we move down to a sort of physical health, the greater likelihood of developing chronic conditions such as cardiovascular disease, diabetes, obesity, increased inflammation, and reduced control of blood glucose levels would all be impacted through our physical health. Our immune function, impaired immune response, leading to increased subsequently to infections, so you've been receptive to getting infections. Also thinking about longevity, increased all cause of mortality as well. So chronic sleep deprivation statistically shortens lifespan. Higher rates of fatal disease such as heart disease and cancer can always be prevalent when sleep is deprived. And also there, we think about weight management, altered hormone levels, increased hunger and appetite, particularly for high calorie foods, decreased energy expenditure as well due to fatigue, and contributing to sort of weight gain are all the sort of impacts to our health when there's poor sleep. Of course, we've also got the impacts of our workplace productivity as well. So, starting with our cognitive performance, there's impairments in attention, alertness, concentration, reasoning, and problem solving. It makes it much more difficult to learn new information when there's an impact of poor sleep. We also have our mental acuity and creativity. This decreases that cognitive flexibility, the creativity and the ability to make decisions. Impaired judgment and increased risk taking behaviours are also prominent. Risk of accidents. So there's a higher susceptibility to accidents due to decreased motor skills and delayed reaction times. Significant contributor to serious accidents and fatalities, particularly in the transportation sector, when poor sleep again is in place. Relationships and social interactions, so increased irritability and decreased patience can really put a strain on personal and professional relationships, reduced ability to process social cues and make those moral judgments as well. The last one that sort of pops up there when we think about poor sleep for workplace productivity is the sudden changes in work. So pattern changes in work, those patterns sort of disturb regular sleep cycle and those sort of rhythms, which is responsible for managing the hormones and the processes in our body and our brain when we're supposed to be awake or asleep. So those shift patterns can really make a difference there as well. So there is some sort of practical tips and strategies to improve our sleep quality, thankfully. On this slide, I've put some sort of practical tips there for us and some strategies that will really sort of help aid improving those sleep. So creating a consistent sleep routine is the first one. So establishing a pre-sleep routine like reading, meditation, or breathing work to signal your body it's time to sleep. Also aim to be quite consistent with your bedtimes, both during the week and the weekends. So it is about keeping things quite consistent there and getting that routine into place. It is about creating an environment conducive for sleep as well. So it's about investing some blackout blinds, possibly curtains, especially for the summer months when it's definitely much brighter. Consider removing electronic devices like our phones and TVs from bedrooms. And practical elements like a good mattress and a pillow can really make a difference to our sleep. We can also create what they call a digital sunset. So it's no artificial light for the last hour before bed. And that's to prevent our brain's response to the stimulus from screens as well. There's no caffeine after midday. So coffee has a half-life of 6 to 8 hours, which means if you particularly have a cup of coffee, say midday, you'll still have caffeine in your system when you're trying to get into that deep sleep. Eat early in the evening. So again, it's when we eat. So your body will struggle to get into that sort of restorative deep sleep, if you like, if it's still trying to digest our food. So we always say to aim to eat at least 3 hours out from sleep. Exercise more. So exercise is very critical to help you feel tired and ready for sleep as well, including those low intensity exercises, especially something like walking can really make a difference. Managing your stress and our worries. Consider trying journaling as a good way, some breath work again, meditation, or even counselling to support with any stressful thoughts or worries that are keeping you awake. Definitely a limit or eliminate some alcohol. So a nightcap actually inhibits your body ability to get into that restorative sleep cycle. So minimizing alcohol intake will really improve that sleep quality. It's also about limiting liquids and the liquid intake before bed. So for practical reasons, you don't want to be disturbing your sleep patterns to go to the toilet. Yeah. And then the last one is to chase the sunlight first thing. So sunlight in the morning will actually kickstart your circadian rhythm, which is your key hormonal process across the day and night. So it's about chasing that sunlight as well. So we can promote sleep hygiene in the workplace. There's many ways that employers can actually play an important role in promoting sleep hygiene and the strategies amongst their workplaces. The first one really is about educating our employees. Many employees may not actually recognise that poor sleep hygiene can have a big impact on their health and work performance. By offering sort of educational pieces on the importance of sleep hygiene can definitely motivate employees to adapt that healthier sleeping habit and increase the workplace productivity. Again, this can be done through educational posters, training sessions like today's taster, for example. Companies can also create a sleep-friendly work environment by reducing noise, controlling light, providing comfortable seating and workstations. For workplaces that require changes in shift patterns, offering maybe nap rooms or other areas where employees can actually take a break and rest during the working day. This can definitely increase work productivity and that employee engagement as well. Encouraging employees to engage in regular physical activity, maintain a balanced diet, and limit caffeine and alcohol consumption can definitely help improve sleep quality and promote overall health and well-being. Another way that this can be done in the workplace is those that maybe offer a canteen service, offering those healthy snacks such as fruit, vegetables, or by offering healthy meal options as an effective way in really encouraging employees to pick those healthier options if that choice is available. And we also have those employee assistance programs or EAPs. These can provide employees, with resources and support for improving sleep quality, as well as managing the stress and anxiety. Promoting good sleep hygiene can definitely benefit both employees and the employers by improving performance, reducing absenteeism and turnover, lowering those healthcare costs, and increasing employee engagement and satisfaction. Employers can really create a more productive and quite a successful workplace as well. So today's tester, as I say, it's all around about sleep and things that we can do as employers. So what we've really covered today then is really the science behind the sleep, the importance of sleep hygiene, and what benefits it has beyond just having that rest, the impact of poor sleep in the overall health and workplace productivity. And we've also had just a look there at the strategies and tips that employers can actually implement to increase the quality of sleep. So if you've got any questions at all, please feel free to pop them into our question service there regarding anything that we've covered today. If there's something that we've maybe not covered, then please don't hesitate to contact us. And again, you can do this by emailing us at inquirieshub@lifelinkwworkwell.org.uk. And we also have our website available as well at www.lifelinkwworkwell.org.uk, as you can see that on the slide there as well. What you can also see is a QR code, and if you've got any feedback at all on today's session, then please scan our QR code and provide that feedback. Alternatively, again, you can direct these to an email as well. Okay, fantastic. Well, I want to thank you all for joining me today, and we really do hope that you have a great day. And as I say, if there's anything at all that maybe weren't answered, then please drop us that email and we'll be delighted to get back to you. Thank you so much for joining me today, and have a great day. Goodbye.